Hi, back with another session here. Recently, we have delivered a conjoined twin baby in our hospital. If you want to have a look, just check out that shot. I will attach in the description. Before starting the topic, I like to discuss some like a fairy tale type of thing. They are Abby and Brittany Hansel. They are now 34-year-old. The two have been a fifth grade teacher. They are well graduated and they are now fifth grade teacher in US. They are actually a paraphagus twins. You can see here also you can see like they are now adults and they are paraphagus twins. They recently got married in 2021 with Bowling and they have a stepdaughter also. They generally share a bloodstream and all the organs below, but they eat and they can write separately and simultaneously. So this is like a very good thing. You can see their marriage photo here. Okay, so now just start. I will just take a topic back. So yeah, conjoined twins. So first, there are two type of twins like dizygotic and monozygotic. What is dizygotic? Dizygotic can be fraternal twins also. If the two eggs released from ovaries, both are separately fertilized by a different sperms, each embryo implants in the womb separately. So because they are implanting separately, they will be in a separate placental uh, and separate like inner sac and separate placentas. So fertilized egg two cell stage will form a different zygotes and different areas of placentation also. Okay, so identical monozygotic twin, how it is forming: fertilized egg, like single sperm single ovum, they will get fertilization and then two cell stage embryo will be formed. Single zygote divide into the two and they are now implanted. So based on like at which stage they are dividing, like if there is a cleavage on the day 1 to 3, they will lead to a dichorionic diamniotic. Like if they are dividing at the morula stage, if they are dividing at blastocyst stage like days 4 to 8, monochorionic diamniotic. That means in a single have a single chorionic cavity but two amniotic cavity. Then, if after implantation, implanted blastocyst on the day 8 to 13, monochorionic, monoamniotic, and formed after forming that embryonic disc, if there is a cleavage on between the days 13 to 15, then there will be a conjoined twin formation. So our main topic here is conjoined twins. You can see here x-ray of their conjoined twins. They are attached here by the heads and the thorax. This is an X-ray of conjoined twins, cephalothoracophagous. That story of Abby and Brittany Hansel we have discussed. They are paraphagous, and I will tell you later, like what is paraphagous. Conjoined twins are a rare complication of monoamniotic twinning. First twin, first ever in the 19th century, Chang and Ang Bunker. They are Siamese, Thai American conjoined twin brothers. That's why for the other name, other term for the conjoined twin is Siamese twins also. Then conjoined twins are the two babies who are born physically connected to each other. Like most often they are physically connected at the chest, abdomen and pelvis. Conjoined twins may also share one or more internal body organs. Like you can see here they are sharing their hearts and they are sharing liver, so they can share organs also. But if they are sharing heart, it is difficult for them and for us also to have a separation surgeries. So the most common type of conjoined twin thoracophagous, by mistake it is printed here 28%, otherwise it's 75%. So thoracophagous being generally they are attached from the upper chest to the lower chest. They usually share a heart, liver, and a part of the digestive system, but the survival rate is very poor, like 5 to 25% only, because separation surgeries are available, but it depends upon the extent of sharing organs between them. So that's why it is not that much possible for them. Omphalophagus is two bodies fused at the lower abdomen. Unlike the thoracophagous, they are joined at thorax. This is at the abdomen level, so they will not share a heart. That's why their survival rate is very good, like 82%, because they'll share liver and digestive system, but they will not share heart. This is a thoracomphalophagus. Body is connected and fused from the upper chest to the lower belly. As of 2015, twins who share a heart have not been able to both survive separation. A designated twin who is allotted the heart may survive if other twin is sacrificed. So one twin is generally sacrificed. Craniophagus is when they have fused skull, and these twins have attachment over the heads. Like it can be from the side, from the back, or but never from the face. Survival rate is very poor. This is heterophagous parasitic twin. The smaller twin you can see here is dependent on the larger twin for its survival. Other rare type of twins is ichthyophagous. Their bodies are attached at 180 degrees. You can see their lower parts of the bodies are fused. This is ichthyophagous. This one is a cephalophagus, whom they are sharing their part of the face, but and they have a common brain. Like difference between craniophagus and cephalophagus is like craniophagus twins are joined at the skull but not the face. They share a portion of the skull but their brains are usually separate. But cephalophagus, as you have seen these girls, you can see this is an example of your cephalophagus. They generally joined at the head, sometimes upper body also, sharing a brain and having faces on the opposite sides of a single head. They rarely survive. But we have seen one example here of cephalophagus. Cephalothoracophagous body is fused at the head and thorax with two faces facing opposite directions, sometimes with a single face and enlarged skull. Ziphiophagous when the two bodies fused in the xiphoid cartilage, as you can see here in the at the xiphoid cartilage. So Pyophagus and Eleophagus, the two bodies joined at the pelvis. Survival rate is 68% for the Pyophagus. Then Rachiphagus, their back is joined, the back of their bodies are joined and with the fusion of the vertebral arches. Paraphagus is fused side by side with a shared pelvis. So now the important sonographic USG findings of the twin lambda sign and T sign. We are generally confused between like when we have to say T sign, when we have to say lambda sign. One more thing, that twin peak sign is a lambda sign. So typical lambda sign you can see in the dichorionic pregnancy and the typical T appearance in the monochorionic pregnancy. I'll give you a mnemonic for that. But first see this one. The twin peak sign, lambda sign, you can appreciate the lambda here. This is for the twin peak sign, dichorionic, diamniotic. Now see, DCDA is a dichorionic diamniotic. Lambda sign we will appreciate in that USG finding. So twin peak sign, mnemonic is DD, that means laddu. So L is lambda and double D is dichorionic diamniotic. Here you can see monochorionic diamniotic. Modi, the most famous tea seller of India. So Modi is monochorionic diamniotic. T sign. Okay, so here you can like observe T. I think you are able to appreciate the T here. This is seen in the monochorionic diamniotic. So on the USG, both twins facing each other, on repeated examination, heads are at the same level and plane. The thoracic cases are in unusual proximity and there is no change in relative position with time or manipulation. The outcome of conjoined twin is poor and dependent largely on the feasibility of the surgical separation. Management. All the conjoined twins are monochorionic, monoamniotic. We generally give steroid for the lung maturity and deliver by C-section at 30 to 34 weeks. We will generally not take this pregnancy beyond 30 to 34 weeks because the chances of the complications. One more thing I'll tell you here, like after the death of Eng and Cheng and Angs, Cheng and Ang, who are the first two ever twins, so after their death, we have done an autopsy for them. In that, Cheng likely have that cerebral blood clot, and Ang death was unclear in that. These are Cheng and Ang Bunker. Thank you.